The new year means new laws go into effect across the country. One of those laws is being called a game changer in the healthcare industry. According to the Urban Institute, inflated hospital bills cause more than 1 in 6 Americans to have medical debt in collections. But a new rule will make information once private to hospitals public knowledge because it requires hospitals to publish the prices they negotiate with insurers for various medical procedures. The author of that article, Cynthia Fisher, joins me now from Sarasota, Florida. She is the founder and chairman of patientsrightsadvocate.org. Cynthia, welcome. Great to have you with us. So clearly you've been fighting for patients' rights for years in Washington, a place well known for its political gridlock. How were you able to get in touch with the right people in the Trump administration to make this law possible?
Well, it's a wonderful day in 2021 that we, as American consumers of healthcare, can finally see the real prices, accurate prices, both the cash prices and the discounted cash rates everywhere we go within a hospital. It is a new rule, and the administration listened. In fact, they invited patients in to meet with the president and Secretary Azar, Secretary Scalia, across the board to listen to patients' plights across our country, where too many people have been blind to know prices before we get care and blindsided oftentimes with outrageous medical bills and then expected to pay with a blank check. Well, as you said, it's game on for a new beginning for the American consumer to actually see and know these prices before we get care so that we can now be in charge of our own healthcare decisions while protecting our wealth decisions. So that means we can shop for the best quality of care at the lowest possible price. And Tanya, what that means is eventually we'll be able to lower not only the costs of our care, but also our insurance coverage by all of us collectively being empowered with these new rules and law.
Sure, we can see how it will increase the competitiveness across the industry. So before we dive into this sweeping change for hospitals and what it will mean for the hospitals, can you walk us through how we got here? Have patients ever been empowered with this kind of pricing information? And if so, how did that change?
Well, very rarely have patients been empowered. In fact, we don't know. In the past, we haven't known what we're going to pay. We go in blindly and then get surprised by huge medical bills where every bill is a surprise because we never know what we're going to pay. Well, that all changes because some very early innovators have started price transparency. Surgical centers like Texas Free Market in Texas, also Midland Surgical Center in South Carolina, Oklahoma Surgical Center, OSS Surgical Center, they started posting their prices online. So you could see, for instance, in the Lancaster and York area in Pennsylvania, that a knee replacement is around $15,000 all in, whether you're a cardiac patient or complex diabetic or a healthy adult getting a knee replacement. It's one price, one patient, all patients. And these low cash prices have generally saved 30 to 50% from the insured rate across our country. So when you look at early innovative employers that also went to the administration along with these surgical centers to show the solution, now the administration interpreted the Obamacare Affordable Care Act law, and we won in the courts just last week, empowering the consumers to be well informed in advance of healthcare prices, not ill-informed by the hospitals. This is a huge victory for American consumers, being both the individual, our families, and our employers to save our very own hard-earned dollars.
And Cynthia, you touched on this earlier, but can you delve into how this price transparency has the potential to reduce healthcare costs for patients?
Well, yes, I'd love to give you an example. For instance, when a woman in Atlanta, Georgia was estimated, and we know cost estimates don't work because they're not real prices, but she was given a range of around $40,000 from two hospitals in Atlanta for her to get her surgery. She went online and shopped and looked at Oklahoma Surgical's price for the same surgery all in. She got to see the quality of their surgery, how many they did, what their infection rate was, and was well informed that she could get a much better price at $3,600 for surgery there. So instead of flying on an airplane to go get that better price and quality surgery, she actually went back to the hospital in Atlanta, and one of those hospitals matched their price and brought it down from $40,000 all the way down to $3,600. Now, so even if we're in a one hospital system in our hometown or a major city where we don't have access to more care, we have the power to actually demand that we get a fair price before we get our care. And Tanya, over 90% of care from hospitals is non-emergent. So that means in most cases, consumers can shop. And then even when we have emergency care, you can imagine that emergency rooms are going to want to be competitive for how they treat their patients as well. Consumers benefit from competition because we know it drives prices down while improving quality and safety. And this can happen in healthcare.
Absolutely. And Cynthia, where will hospitals, be forced to publish this information? Will it all be online? And to follow, what should a patient do if he or she really needs the procedure, learns the price, but still can't afford it?
Well, that's a really good question. And I think it is where we as consumers all need to be our own advocates now, because we have been given the power to get quality care at prices we know we can afford. So when we look online now, every hospital is to actually have these prices posted online, easy for us to access and search, to get these prices in advance. And know that the discounted cash prices, so if someone doesn't have insurance or if they find it's difficult, most of the discounted cash prices, paying cash, lowers the rates. Dr. Larry Van Horn at Vanderbilt University looked at historical data and found in the same facility, in the same physician team, the same procedure, oftentimes if paid cash, discounted cash rates are 40% lower than the negotiated rates. That's a huge win for all of us consumers. It's a huge win for employers if we start changing the model of healthcare by being empowered. And if we can't afford it, if we think we can't afford care, we can use our voice and negotiate just like that woman in Atlanta did, where the hospital met the lower price of competitors out of state.
Cynthia Fisher, thank you so much for joining us. We really appreciate it.
Thank you, Tanya. It's a pleasure to be here, and it's a great year for the American consumers to lower their costs of both care and health coverage in the years to come.